There are two drugs that are currently under study, and some data were presented during this meeting. One was a drug from Agios Pharmaceuticals called AG120, and another from Novartis, IDH305, both of which inhibit IDH1 altered proteins in patients with IDH1 mutation. Another drug, AG221, targets IDH2 altered proteins. IDH2 mutations are more common than IDH1 mutations. They're a very interesting alteration. They lead to the proliferation of an oncometabolite called 2-hydroxyglutarate, which inhibits TET function and causes aberrant methylation profiles, shutting down normal differentiation of marrow cells. So when you block that altered protein, it allows release of that block, and then normal myeloid maturation and differentiation, and patients actually begin to develop normal white cells again, and instead of having a marrow full of leukemia, over time they develop more and more mature cells and develop a response. Now, the response rate, the complete remission rate, depending on the study you look at, ranges between 20 and 30%, so it's not all patients that respond, but the overall response rate is higher. At least with the AG120 and AG221 studies, the overall response rate that includes also morphologic leukemia-free state, partial responses, they tend to reach the 40% marker. So it's impressive for this patient population that has a specific type of mutation, mainly because many of them have relapse refractory disease for which there aren't other options. And so if you are able to achieve a response in this patient population, perhaps you can take them to a curative modality such as transplant and attempt to cure them of their disease.